Hello and welcome to another video of medicine in 10 minutes or less. In this video, we are going to talk about the most important points that you need to know about pleural effusion. The last type of pleural effusion that we are going to talk about is usually neglected. So make sure that you stick until the end of the video. So grab your coffee and let's go. First thing you need to know about the pleural effusion is the differences between the pH levels. The normal pH of the pleural fluid is approximately 7.6. The transudative pleural effusion has a pH of 7.4 to 7.55. It is usually caused by systemic factors. The oxidative pleural effusion has a pH of 7.3 to 7.45. It is usually caused by an inflammation. A pleural fluid pH of less than 7.3 is suggestive of either increased acid production by pleural fluid cells and bacteria, like in the case of empyema, or decreased hydrogen ions efflux from the pleural space, like in the cases of pleuritis, tumors, and pleural fibrosis. Other very important points to differentiate between oxidates and transudates is the protein levels and the LDH levels. Protein levels more than 50% of the serum protein indicates oxidative effusion. Also, LDH levels of more than 60% of the serum LDH indicates oxidative effusion. Now, what are the causes of the oxidative pleural effusion? Well, there are many causes, and here we will mention the most important ones. Mostly it will be caused by infections. Also, pancreatitis can cause it, sarcoidosis, cancer, pulmonary embolism, and connective tissue diseases like SLE, rheumatoid arthritis, GPA, and eosinophilic GPA. When it comes to the transudative pleural effusion, the causes are mainly systemic. For example, we have the congestive heart failure, often leads to increased hydrostatic pressure, which cause fluid accumulation. Atelectasis also causes transudative pleural effusion because it causes localized pleural effusion due to lung collapse. Transudative pleural effusion can also be caused by decreased oncotic pressure. We can see this case in nephrotic syndrome because of the protein loss, which leads to fluid buildup. Hypoalbuminemia also causes a decrease in oncotic pressure, which contributes to fluid accumulation. Now we will talk about a very serious cause of pleural effusion, which is empyema. Empyema is caused by the bacterial invasion of the pleural space, leading to fibrinopurulent consolidation. The clinical features of empyema is similar to pneumonia symptoms. It has insidious presentation with lab evidence of inflammation. The common organisms that cause empyema are oral anaerobic bacteria, Streptococcus pneumonia, and Staphylococcus aureus. The management of empyema consists of antibiotics, chest tube drainage, and also intrapleural fibrinolytic drugs, which may assist drainage. Surgical decortication is used for highly fibrotic loculated effusions. And last but not least, we have the chylothorax. A chylous effusion is defined as a lymphatic leak into the pleural space with pH between 7.4 to 7.8. Now, the chylothorax can be either caused by trauma, like thoracic surgery, or can be non-traumatic, which is associated with conditions like malignancy or lymphoma. The chylous effusion and empyema have similar appearance, and the centrifugation will help differentiate between them. Clear appearance after centrifugation indicates empyema, while the milky appearance after centrifugation indicates chylothorax. Don't forget to like and subscribe to our channel to see the next videos.